Hi everyone, my name is Angeline Smalls. I'm the owner of Anti Salon and Spa. We actually are here to pretty much talk to you a little bit about wigs that we do make for anyone that actually have hair loss or maybe undergoing chemo or radiation. This is one of our latest and dearest endeavor that we started making wigs for anyone that's going through chemo. So I have one of our clients here with us who is very special to us. So we're going to be going into talking to her about her experience and pretty much just showing you guys what we can do here for you, which is making custom wigs with your own hair. So right now I have Christy, and Christy can just pretty much take over. And hi Christy.
Hi.
Hi. Maybe you want to just introduce yourself to everyone and just explain, to them what your experience, or even when you first found out you had cancer, what was it like for you?
Sure. So, hi, my name's Christy. I'm 32 years old. I actually just graduated from college in May, and I started showing symptoms in June, and I was diagnosed with stage 4 inflammatory breast cancer on July 31st, 2013. And that week was pretty much a whirlwind. I went in to the doctors. I unexpectedly got 8 hours worth of I spent 8 hours getting biopsies done. That was July 29th. July 31st, I got my diagnosis, and August 2nd, I started my chemotherapy. That was a Friday. And during that time, I kept joking with people, I've donated my hair to Locks of Love 3 times, and why can't I donate my hair to myself?
Exactly.
So I said that to actually Diane of Specialty Fittings.
Okay.
And she told me that, it's funny I should say that she just talked to you guys the day before.
Wow.
And she would give me your contact information.
So first it was just a joke.
It was just a joke.
Why can't I donate my hair to myself?
Right, right.
Your hair is beautiful. So
thank you.
And for you to say that then.
So that was on a Friday. I got my chemo, and that Monday I came in to you guys to donate my hair to myself.
Amazing. Oh my gosh. And I have to say, when I first met you, and you came in with your parents, and right away the first thing I thought was just, you were so young, and I felt that it could be, myself or anyone of your age group, so that was very much touching, to me. So now you knew you were going to lose your hair.
Yes.
So you decided.
That's why I acted quickly.
Wow.
I knew that there was a very short period of time that I was going to be able to do anything with my hair.
Okay.
So once I did find out that it could possibly be done, that's when I made that appointment. That's why I started chemo on Friday, and 2 days later I came in and had it all chopped off.
Wow. I have to say, when you came in, you were a sport. As much as, I had chills, and your whole family, and you had chills while cutting your hair, I have to say, first of all, your hair, when you came in, gorgeous, so I would donate my own hair. If I had hair like you, I would donate it to myself.
Thank you.
And I have to say, pretty much, when she decided to cut her hair right away, what we normally do here at the salon, we pretty much just cut your hair to the shortest length to have you leave with a pixie cut. So you're not leaving with with you not having any hair. So you're leaving with hair, but it's more of like a short pixie cut, so you're leaving with something. And then we keep the hair in the bag, and we put little clips on there, and then we bag it nicely, and then we just pretty much just have her go through the process of picking out different lace that we're going to use. And Christy's pretty much going to show you what her lace look like, and I can demonstrate and show you guys. So right after you met your oncology doctor, then they told you were going to be losing your hair, right?
Right.
Okay.
And along with a slew of other side effects. So everything was out of my hands. Everything that I had control of, I was losing control of. All these things were being done to my body, getting visible scars put on my body, and
Wow.
this was one of the few things that I could do that I had control over.
Well,
you know,
yes.
was I was going to cut off my hair before it was going to get taken from me.
And that's important.
Yes.
Because if we can help you save your hair,
Right.
you know, the first thing you thought about was just to cut it off before you lose it.
Right. Right.
Yeah.
I've always had long hair. It's like my signature trademark. You know, and
it's never been colored, or
no. The last time I colored it, I was in high school, and it was, you know, purple or something
Wow.
like that.
Yeah.
So, you know,
Nice.
it's always the same color.
Oh my gosh. So, you know, like I said, right now, Christy is wearing her wig that we made for her. Looking at her now, you can't even tell. When I first met her, this is exactly how she looked. Her hair, nothing ever changed. And, you know, as you can see, you know, looks so natural. And if we can put a close up and just so we can show you how natural these wigs are that we make in here, we're gonna have you, you know, come a little closer and we can just open her hair and the scalp so you can see that the hairs that's attached to the foundation that we use, that you can see that the hairs are coming directly out of her scalp. It looks like it. It's not, but that's how natural the wigs are that we make.
So I love my wig. It makes me feel like myself, and it doesn't advertise that I have cancer to strangers. I don't like scars because I feel like it's a big bulletin board that lets everybody know that I have cancer. And I'm not embarrassed by that, but it's not something that I need to have people know all the time. And when I want to wear my hats, I wear my hats, but my wig, I feel like myself when I'm wearing my wig. And I feel connected to the person who I was before I was diagnosed. So I know you guys have been wondering if this is really my hair, and it is my hair, obviously, because I've been telling you about it, but it's my hair on a wig, and I'll show you. This is my head, and this is my beautiful wig. Thank you. Thank you, Salon. This is awesome. So cancer has a way of trying to define you. But with this doesn't define me. This reminds me of who I was and who I am before I was diagnosed. And when I put this on and I look in the mirror, I'm reminded of who I am and who that person was before I got diagnosed. And I get these little tabs and I just try to adjust them right there. And then just play with it. Fix my baby hairs. And that's it. When I came in that day to cut my hair off, I was very upset, very nervous. I mean, when you've always had long hair, it's kind of frightening just to get a short haircut, let alone know that you're going to be losing your hair and cutting it off as short as possible. But when I came in, Angeline and Janique, they were so sweet and they were so nice and they made me feel so welcome that I was actually smiling and happy when they were cutting my hair off. And I did about 7 of the cuts, and they did the ones that I couldn't see, and again, that helped me have control. I highly recommend anyone that's had a recent diagnosis to come to Salon, see Angeline, get a consultation, and donate your hair. Time is of the essence. I lost my hair within 2 weeks of starting chemo, and I'm so thankful that I did this, because otherwise I would have nothing to otherwise I wouldn't have my own hair. I would have this funky stubble that's coming through, and I would have somebody else's hair, or I'd have a fake wig,